There's a lot of feedback.
Tracy, can you hear me?
I can, yes.
Okay. Any echo?
There's not now, no.
Okay.
Hey, Stuart, will you help me check the questions on YouTube Live if you don't care also?
We are live and the meeting will start in about 3 minutes. Meeting will begin in about 2 minutes. The meeting will begin in about 1 minute. All right, Tracy, I have 2 o'clock if you want to get started. I think Stuart will be doing the situation update today since he's there by the board.
All right, thank you all for joining us today for our January 27th update of COVID-19 across the Lake Cumberland District. Stuart, do you care to share our situation update?
Yes. Let me make sure. Can you still hear me okay, Tracy?
Yes, you're good.
Okay. All right. As of yesterday evening, so I'm going to be looking off at the board to read these. Adair County has had a total of 1,495 cases. They are at a rate of 29.76 per 100,000. They are still in the red. 48 deaths. They have an active count of 32 cases currently. 31 of those are in the hospital and 31 are isolated and 1 is in the hospital. Casey County, 1,113 total cases. They are at a 68.96 cases per 100,000. They're in the red. They have had 30 deaths attributed to COVID. They have 64 active cases. 60 of those are isolated. 4 are in the hospital. Clinton County has had 1,249 cases. They are at 72.7 per 100,000 cases, and their number of deaths in Clinton County is 26. 1,169 of those cases have been released, of course. Active cases, 54. Isolated at this time, 51, and 3 of those are in the hospital. Cumberland County has had a total of 587 cases, 8 deaths, 33 active cases at this time, 29 isolated, and 4 in the hospital. They are at a 71.28 per 100,000. Greene County is 971 total cases with 13 deaths. 42 cases are active at this time. 42 of those are self-isolated and 0 are in the hospital. McCreary County has had 1,451 cases. They are at a 77.93 per 100,000. They have 83 active cases. 76 of those are isolated. 7 of those are in the hospital at this time. Pulaski County has had 5,035 total cases, 73 deaths. 206 are currently isolated and 21 in the hospital for a total of 227 active cases at this time. Pulaski County is at 54.08 cases per 100,000. Russell County is, 1,412 total cases since the beginning. They have had 36 deaths. 68 cases are active at this time. 58 of those are isolated. 10 are in the hospital. Russell County is at 53.4 cases per 100,000. Taylor County has had 2,235 total cases, 28 deaths. 110 cases are active. 105 are self-isolated. 5 of those are in the hospital. They are at a 73.73 cases per 100,000. Wayne County, 1,883 cases since the beginning with 36 deaths. Active at this time is 71 cases. 65 of those are isolated. 6 are in the hospital, and they are at a rate of 44.97 per 100,000. The district total for all counties, 17,431 total cases since the beginning of the outbreak, 316 deaths. We have 784 active cases. 723 of those are isolated right now, and 61 of those are in the hospital. And our state positivity rate at this time is 9.63.
Thank you, Stuart.
I can add to that, Tracy. We had about 14 days of our cases going down, and then we had about 6 days where they went back up daily, slightly compared to the week before. And for the last couple of days, they've kind of leveled back out again. So we hope we're plateaued. Even on those 6 days where they were going back up, they weren't going back up drastically. So we do hope we're plateaued, and we hope cases start going down.
Good.
I would also say, Tracy, that all of our counties are still currently in the red. Adair County at 29.76 is the closest to going to orange. That level would be at 24, I think, less than 25 cases. So they're the closest that we have.
Okay. Are there any other updates you want to share before we move forward?
I do see we have 44 people watching live, Tracy, and if any of them want to type something in the chat box, we are watching the YouTube live chat box for questions also.
Okay. So I'm going to go ahead and start with the questions. Is there any data on if a person could still be a carrier of the virus once they have been vaccinated? Yes, that's you, Dr. Wayman.
Unfortunately, this is one question which has not been fully answered. Therefore, wearing masks, distancing, and complying with quarantine is still applicable. The studies are ongoing, so hopefully in a little while we will know this answer.
Okay. Next question. Is the health department not contacting positive cases anymore on a daily basis? Some positive cases are stating that they are not receiving daily or even periodic calls during their isolation like many were previously.
We continue at the Lake Cumberland District Health Department, we continue to do case investigation and we continue to do contact tracing. And when someone reaches the end of their isolation, we continue to do the releases. Now, once our case volume got so high, we did stop the practice of calling positive cases daily or 3 or 4 times a week to check on them. Instead, we instructed them that if they have any issues to reach back to us. Otherwise, if we don't hear from them whenever the date comes, that is the first possible date they could be released, we reach back out to them to make sure they're doing okay. We reassess them on that date, and if everything is fine, we go ahead and release them from isolation. Otherwise, if they're still having certain issues that would be of public health concern, we go ahead and hold them on isolation for a few more days. Which that's one of the things, to digress a little bit, you know, people sometimes ask why we release people who are still sick. You know, we're only, from a public health perspective, we only follow a case until we consider them to be no longer contagious. They could still be sick, but not contagious. What's the criteria on that, Dr. Wayman?
It has to be at least 10 days since symptom onset. The person has to be afebrile for at least 24 hours. That is no fever. And their symptoms have to be improving.
Okay. So if they meet that criteria, we consider them as no longer contagious and they would be released from public health observation or following. That doesn't mean they're completely recovered. They may still be physically sick for some length of time after that. So it's a little bit different what the like what your doctor's office monitors versus what we monitor.
And that actually is the next question, Sean.
Oh, well, good.
It asks, if contacts are not made periodically through the course of the isolation with the positive case, why are cases not turned over to their primary care physicians for release dates? Would a physician not know more about the person's overall health, underlying conditions, etc., to make a determination rather than just a 10-day count by the health department?
Yeah, well, someone's family doctor is going to know more about their health conditions anyway because they're their family doctor and their medical home and the person who follows them. Again, our purpose in following the person is not to measure their individual physical health. Our purpose is to monitor whether or not they remain contagious, because public health's part in this is to try to control the spread of the disease. So public health is the one in charge of isolation and quarantine orders. So if someone is considered still contagious, we would follow them and keep them on isolation until we consider them not contagious, and then we release them. According to Kentucky law, it's the health departments who have that authority to isolate and to release. So that's the part that we do. So I think that's a pretty solid answer, isn't it, Dr. Wayman? Is there something you want to add?
No. Thank you. Oh, yes, I do. I was going to say that when we discuss it with the patients on the phone, if we find out that they do have severe disease or they're still not getting better, then they are not released from isolation. And they may stay there for up to 20 days or longer.
Yeah, and if they're having problems, we would refer them to their medical doctor or to the hospital or whatever is appropriate, correct?
Correct. Yes.
Okay, next question. How confident can one be that they are not contagious if they still test positive after the 10 days? Many cases are asymptomatic with no fever or symptoms and yet still contagious. Yet fever-free and no symptoms for 48 hours is enough to grant a release even though they may still be test positive. Would that not be a live virus that could be spread through the event of coughing or sneezing without any other symptoms present? Would this not classify the person as still being a carrier of the virus?
So since this epidemic began last March, the amount of research that has been done has been enormous and exponential, not only in the basic sciences, but also in the clinical arena. And many studies have confirmed that viable virus numbers decrease over time and are at such low levels after 10 days as to be non-transmissible. Remnants of the genetic material, which is the RNA from the virus, can linger for weeks or months. And from studies, we know that this does not infect other people. Those who have severe disease may be contagious for longer, and thus we isolate them for 20 days or more if necessary. Unfortunately, for those that test positive and are asymptomatic, we don't know when they got infected, so we automatically count 10 days from their test date. We think that should be adequate to make them non-contagious.
Okay.
And, like a lot of things, Dr. Wayman, when we ask people to mask and social distance or when we use these criteria, none of this is absolutely 100% perfect. All of this is designed to decrease the risk so that we can slow the spread so that the disease doesn't, grow and spread in the community so quickly that it overwhelms the health system. We want people to be as safe as possible for as long as possible so we can give the vaccine time to be developed and get it out. But, there's always still, I guess, some small degree of risk, no matter how many precautions you take.
Yes, correct.
Sean, are there any questions in the chat box?
I don't see any questions, so I'll ask we got 51 people watching live now. If any of you guys have questions, go ahead and type them in. Those were the only 4 questions that were submitted. We're going to go ahead and take a few minutes to talk about some of the real common vaccine questions that we get asked, mostly about vaccine supply and why it's not readily available. So I'll start at the global level. The few drug companies that are trying to manufacture this vaccine are trying to create enough for the entire planet Earth. As human beings, we've become, especially, in our country and most of the industrialized countries, we've become accustomed to, if we want a vaccine, we just call and get an appointment and go get it. But that's vaccines for diseases that have been around for years, and there's already a supply process and a manufacturing process. The companies know about how much demand there's going to be, and they just produce enough vaccine each year to cover that. With COVID-19, the vaccine has just been created, and they're just now starting to ramp up the production of it. So it's going to take time to get enough vaccine for everyone that wants it. Currently, for Kentucky's being shipped about between 50 and 55,000 doses of vaccine per week. And the State Department for Public Health is having to decide how to spread that out across the 120 counties. we got a population in Kentucky of 4.5 million people, and 55,000 doses are coming in a week to spread out across 120 counties to try to get it to 4.5 million people. When you do the math, you see that's going to take years if the supply isn't increased to get enough vaccine for the entire population. Now, not everyone qualifies for the vaccine. Young people don't, and not everybody's going to want it. But even if we say half of the 4.5 million, 2.25 million, it's still going to take a long time unless the supply increases to get that at 55,000 a week to reach that entire population that wants it. That's why the prioritization has happened. That's why we did, the first priority group was hospital staff, medical staff, and long-term care residents. And in our district and in the state of Kentucky, long-term care is being taken care of by a federal contract with Walgreens and CVS. The state has nothing to do with that decision, and the locals, us, we had nothing to do with that decision. I understand that if not every nursing home, almost every nursing home has at least had the first dose of the vaccine, so that process, though it's not going as quick as we wanted, is happening. For everyone that's in the medical community, hospital staff, medical staff, for everyone that signed up on that initial list, pretty much everyone that wanted it has received it. Now, there have been some people that have signed that wasn't on the original list that have decided later they want it, and it may not be available for everyone that wants it now, but everyone who originally signed up for it, as far as medical staff, hospital staff, they pretty much received it. And that either took care of or is taking care of the Group 1A. When I say or is taking care of, I'm talking about the nursing homes through the federal CVS and Walgreens. That's being taken care of. The next group we're trying to deal with that very limited supply of vaccine is 1B, which includes first responders, school staff, and those 70 and older. We were able in Lake Cumberland to get most of our first responders, fire, police, and so forth, taken care of with some leftover vaccine we had from the 1A category. Now, what do I mean by that? When we order the vaccine, it comes in shipments of 200 doses or 100 doses. So maybe we only needed 150 for a county to get all of their medical folks, and there was 50 doses left over. Well, we rolled that to the first responders in our counties, and that's how they got taken care of. The surplus 1A vaccine was used for those first responders. Now, right now, the governor has made arrangements for school clinics so we can get school staff taken care of. In our district last week, we took care, or the shipments of vaccine applied to providers who took care of Adair, Casey, and Clinton. Taylor was largely taken care of a couple of weeks before that. And this week, we're starting on Pulaski. Let's see, Adair, Casey, Cumberland, Green, Russell, and Wayne. We'll be starting this week and finishing up next week, and Pulaski will be finishing up next week along with McQuarrie. So, there's a 3-week span there, and we're in the middle of it, where most of the state's vaccine supply is either going to these regional distribution centers or to school staff. And that's tying up the 55,000 doses that's coming in per week. The next group after we get it past the schools is the 70 and older. Now, at 55,000 doses a week to take care of all of the school staff, it still takes about 3 weeks. At 55,000 doses a week coming into the state to take care of the 70 and older, it's going to take 3 to 4 months if the vaccine supply doesn't come in quicker. So that's probably a big part of why the state decided to go with the school staff before the 70 and older, because it could be, that group could be knocked out in a much shorter period of time in those 3 weeks. Now, people often ask, why are certain places in the state doing things different? Well, as I understand it, nobody still has been authorized to order any 1B vaccine other than the 1B vaccine that's going out for these school clinics.
He's up.
Places are still ordering 1A vaccine for medical providers, hospitals, and so forth. And if they end up with a little bit too much, they are using what's left over for the 1B population. And sometimes you'll see some places across the state advertise for some 70 and older clinics. That's mostly just surplus 1A vaccine. There may be some places in the state where the governor's worked out with a certain clinic or a certain place, and they're already doing 70 and older. I don't know everything that's been worked out. I'm just telling you, generally speaking, the way it's working. My understanding is after the school stuff gets taken care of next week, the week after that, there's going to be a big push to do the 70 and older, and that'll unfold over the next 3 to 4 months. Now, the governor says he has a big announcement on Thursday, tomorrow. I'm not sure what that will be. It may be that the state, maybe the federal government's going to find a way to get the state some more vaccine. Maybe the governor's going to talk about these big mass drive-through clinics that he's trying to set up through a Kroger contract. I'm not entirely sure what that announcement will be. I know there's been some messaging coming out that's not entirely clear. I've seen some correspondence that said if you're in the 1C group, there'll be some clinics available for you also. And then I've also heard officials say, well, that's only going to be if you have some leftover 70 and older vaccine. Like, let's say you order some and you have a little left over at the end of the day and you can't find any 70-year-olds, then instead of wasting the vaccine, you could finish up 3 or 4 or 5 doses, whatever's left in that vial, with some of the 1C. But that's not going to be, as I understand it, the big focus. The big focus is going to be 70 and older. So it's going to be a while before we get to 1C, unless the governor says something different Thursday or things change. I don't make those rules, but certainly getting the 70 and older group vaccinated is going to give us the biggest public health return, because the 70 and older group is 75% of our deaths and 50% of our hospitalizations approximately. So if over the next 3 or 4 months, that'll take us into early summer, we can have worked our way through the 70 and older population, the public health perspective should look a whole lot brighter, just because that's the groups that that's the group that dies mostly and ends up mostly hospitalized. So we'll get a lot of improvement just from doing that. So I hope that helps to make things clear. I know Stuart and me and the clinics and our call center, I mean, we are getting tons of calls and messages about, when can I get in for the vaccine? When can I get in? As soon as we know anything different, we will let you know. I post that information every day in our brief. I'm going to put it on our website and on social media. Everything I know, I put there. When people call us and want more information than what we're putting in our brief, we don't have that information. We don't have access to the information you're asking. We can only tell you what's in that brief. And people get angry because that's not what they want to hear. They want to hear, where can I get the vaccine and when? And when we tell them, right now the only doses that's coming into our district for the public is the 500 doses that's coming to Lake Cumberland Regional Hospital. And Lake Cumberland Regional Hospital, when they open up their phone lines to take those appointment schedules, they fill up their 500 appointment slots in just a few minutes. So, people get frustrated. They call the hospital says our appointments are full. And the hospital may say, well, call the health department. They may have more information. Then you call us, and all we're able to tell you is what we know. And what we know is the only 500 doses coming in is going to the hospital. And when we know more, we'll tell you. And that's not what people want to hear. And I'm sorry. I wish there was better information. There's nothing I can do, or the county judges can do, or the governor can do about getting more vaccine coming into the state. I mean, maybe the governor can convince the federal government that Kentucky's doing a real good job and some other state in the nation is not. And instead of sending it to them, they should send it to us. I mean, maybe that could happen and some more could come in. Maybe some new drug company will get their vaccine approved and there'll be more supply that comes in that way. But anyway, as soon as we know anything, we will certainly let the public know. One other question people ask is, why are we not keeping a waiting list? Because we've not been promised any more vaccine. I mean, to put people's name on a waiting list when we don't even know if we're going to get vaccine, I don't know what the governor's plan is. If maybe all he's going to use the vaccine for is the big Kroger mass drive-through clinics. And if so, putting people on a waiting list would give them a false sense of security that they've got a vaccine coming soon when we got no promise of that. So there are health departments in the state that are keeping waiting lists, but their directors told me, or told the group at the last call meeting, their waiting list has grown to the several thousand, and they've not been promised any vaccine either. And the people that were put on that waiting list are now calling back in saying, well, why haven't you called me? Well, because they don't have any vaccine. So, I mean, it doesn't make a lot of sense to me to keep a waiting list when we've not been promised vaccine. And so anyway, as soon as if we get vaccine, we will let people know, and we'll open up the appointment lines just as soon as we know. And that's the best we can do. So, Stuart, Dr. Wayman, you want to add anything to any of that?
I just wanted to say, Sean, I've talked with Amy Tomlinson here in our preparedness branch, and she got some pretty accurate numbers on our 70 plus group of people in Lake Cumberland District, and we're looking at about 28,000 people. So, you can kind of do the math with the numbers you've talked about at 500 doses a week coming in and 28,000 people. Of course, you can figure that there's probably around about, I'm going to guess and say 1,000 people potentially in nursing home or in a care home of some sort, and maybe give or take a little bit on that. So still, there's going to be 26 to 27,000 people who are competing for those 500 doses of vaccine that comes in every week.
Yeah, and Lake Cumberland makes up almost 5% of the state's total population. And if we were getting proportionally our share of the state's 55,000 doses, which we're not, it would be about 2,300 doses a week. Now, last time I said that, people got confused and thought I was saying we're getting 2,300 doses a week. That's not what I'm saying. I'm saying if they start dividing it up by your percent of your proportion of the state's population, that's what we would get. But it's still, we were getting that, and it's 2,300 doses and 23,000 people, you're still talking about several weeks to be able to get this done. Plus the second doses, you have to double that. So, 10 weeks is still, you're getting into 2.5 or 3 months. So, it's going to be a while before we get through the 70 and older group. So anyway, as we learn more information, we will certainly let you know when the governor makes his announcements Thursday, whatever they are. We'll pass that along. And if the Department for Public Health reaches out to us to give us more information, we'll pass that along. We've already let the Department for Public Health know we're ready. We can give a lot of vaccine. If it's available, we're ready. We stand ready to do that. There's other providers in our community They stand ready to do that. So it's not an issue of do we have people able and willing to do it? We do. It's just we need the vaccine. The only other piece of information I know is I understand the federal government is trying to work out some deal where they would direct ship some vaccine to some pharmacies. That may be several months away before that happens. But I understand that's in the works. So maybe the thought is when the vaccine production is ramped up and there's more companies approved, that'll be a way to get it to more providers to make it easier to find someone to get an appointment with. But again, I would expect that's going to be several weeks or several months down the road. No one's typed in any questions, Tracy, which is a surprise. As many questions as we get every day about the vaccine, I'm surprised nobody's typing anything in.
Okay.
Dr. Wayman, do you have anything to add about the vaccines, or do you think me and Stuart covered it?
I think you covered it. The supply is the problem. And some time ago, I read that Moderna was going to have maybe 100 million doses come February or March, and I think that's what we're waiting for. Johnson & Johnson is in phase 3 trials, as is AstraZeneca in the United States. They are also doing trials. So given a month or two, we should have more vaccine.
Yeah, a month or two is a long time for people that want it now. And, I understand that we are accustomed to get a vaccine, you can call and get it. This is the first time in a lot of our lifetimes that you just couldn't call and schedule an appointment when you wanted it, and so, and it does get confusing because, different places in the state are doing different things. They have some leftover vaccine and they use it in different ways. And people will look on social media and they'll say, well, Lexington's doing this, or Louisville's doing that, or Corbin's doing this, or Bowling Green's doing this. Well, that may be because they just had, a small supply of leftover vaccine and they're doing a special clinic. That's certainly not what's the standard across the whole state all the time. So I'm sure we've done things in our district that other places from outside have looked in, and people in Bowling Green have said, well, why is Lake Cumberland doing this? It works the same way, but all we know is what we know, and as far as the vaccine, all we get is what we can get. I've had plenty of people get mad at me saying, well, why aren't you getting in touch with people in power and telling them to send you more? Well, believe me, I've reached out to everyone that I can to tell them we're ready and we can. It's just a matter of getting it. I can't make people give us more than what they feel like our share should be. So still don't see any questions typed in. So
All right.
I think just to let you know, to say that there's vaccine out there as far as at these regional centers. Go on the map on KY COVID-19 website. You can look those up. You can look and see where those are at and contact those places and get an appointment. Now, I'm not saying, let me say this, they're all getting limited vaccine, so you can contact them and try to get an appointment. You may or may not get in this week. You have to be very diligent right now because the supply is so limited. And you may, if you're willing to go to somewhere like Lexington, you may be able to get a vaccine at UK or at Baptist Health. But also remember that when you do that, you will have to travel back for that second dose because, one, if you came here to us, we wouldn't necessarily know which vaccine you got, if it was Moderna or Pfizer, or if Johnson & Johnson is out by then, or AstraZeneca. So we wouldn't know that, and they will know your time frame and all that information. So you need to go to the place where you took your initial dose to get your second dose.
So Tracy, it's still a good idea for people to mask and social distance. We've not had 10% of our population yet that have tested positive. I think we're still around somewhere over 8%. Even if you double that and say, well, 16% have had it, or 20% of our population, we've still got, 85% of our population hasn't had COVID-19 yet. There's still a lot of people out there that can still catch this. I know several members of my family, my extended family, have come down with COVID recently, and it's not been a pleasant experience for them. Fortunately, they haven't had to be hospitalized, but they've been very sick. One family member's had to be put on oxygen, so not doing as well, and several of them still feeling sick several weeks later. So it's not a pretty thing to deal with. They all tell me they wish they had taken everything way more seriously when they had the chance. And that's what we hear over and over. It's easy. When it hits home, that's when you start thinking, man, maybe I should have done something different. Well, I would rather it not hit home for people. So, avoid the crowds, social distance, wear your mask, get the vaccine as soon as you can. Don't try to cut line in front of somebody. We got to get these 70-year-olds done quicker. So please try to resist the urge to cut yourself in front of the 70-year-old and older, 70 and older, if you would.
Yeah, Sean, and to add to that, I believe it was yesterday that the governor announced that they had detected that other strain in Kentucky. Of course, it's probably been here, longer than that, and Dr. Wayman would know much more about that strain, but I believe it's an easier to catch strain.
Much more transmissible.
Yep.
Doesn't make you any sicker than the previous strain. It probably has been here a long time. Since we don't do surveillance, we don't know. But certain states are doing surveillance, and they found it was here at least in September.
Yeah. I think Dr. Wayman, Dr. Stack said they are doing some degree of surveillance. They are testing a certain percentage of...
Well, they are now.
Yeah.
Yes, absolutely.
So anyway, you're probably more up on that than me, but there are... Anyway, at least with these new strains, even though they may spread much quicker, they still respond to the vaccine. So the vaccine's still good. The thing, too, about the vaccine that we didn't talk about, and again, Dr. Wayman can say this better than me, is the vaccine is designed so if you contract the virus, you don't get as sick from it, or you don't get sick from it. Now, what the verdict is still out, can you still contract it and spread it? So that's why, the research is happening feverishly right now to try to find the answer to that, because, if the vaccine also will prevent you from either catching it or spreading it, then, man, we can get back to normal a lot faster. Otherwise, it's going to still be some social distancing and masking, at least throughout the summer, to get us to where we want to get to, maybe longer than that. Is that pretty accurate, Dr. Wayman?
That's very accurate, yes.
Yeah.
So basically, you could be asymptomatic and spreading and not know it, even though you've been vaccinated.
But it's good that you don't get sick. That's good news. All right. So I still don't see any questions, Tracy. I've tried to stall a little bit to give people a chance. I guess we will wind off if you want.
Questions, it says, when we get vaccine, do we still have to wear masks?
I'll let Dr. Wayman answer that.
I think we just answered that. Basically, since we're not sure whether you can become infected and be asymptomatic and spread the virus, we do still have to wear a mask and distance until we have more information anyway.
Yeah, and I don't know personally, but I feel very confident that there's people researching that vigorously right now, because that's a big deal. It's a big deal. Of course, if enough people have had the disease and enough people have had the vaccine, it becomes less of a concern. But while we still have 80% of our population that's not had the virus, there's still a lot of concern. So,
Tracy, would you mind to remind people about we still are in flu season before we sign off?
Yes, I will. Please remember to get your flu shot if you have not, because it is the height of flu season, right, Dr. Wayman?
Yes, but don't do it 14 days before or 14 days after your COVID vaccine.
It's true. True. Okay. Thank you for sharing that.
I'll remind people to read our daily brief. We post it on our website every day, and we share that on Facebook every day. As we learn more, we will post it there, and the information that you guys want to know is there. Now, maybe it's not exactly what you want to hear. You may read on there there's still no vaccine in our area, but that's the truth as we know it that day. So do look there.
All right. Thank you all for joining us today. If you all have nothing else to share, and we will be back in 2 weeks, which will be February the 10th, I believe, to share additional updates.
Thank you all for tuning in.
Thank you.
Thank you.